We aren't allowing vaccinated people into unvaccinated people into restaurants, but they are still allowed to visit patients in acute care. Is this true, and if so, what are the risks?
Well, maybe I can answer this just briefly. The vaccine passport requires people to be vaccinated to do certain discretionary activities, such as go to restaurants, movies, gyms. Not because these places are high risk. We're not actually seeing COVID transmission in these settings. It's really to create an incentive to improve our vaccination coverage. But we still allow people to continue with essential things like going to the grocery store, going to the pharmacy, going to visit relatives in acute care, going to access healthcare services. And by the way, when those people come to our acute care, they're going to be screened and they're going to be given a medical mask. And we're not seeing transmission from visitors. We've seen occasionally visitors to healthcare facilities have been a source of COVID, but they're actually lower risk than staff because they tend to only visit one person, have contact with their relative, and then leave. Whereas healthcare workers who may have had COVID and been in the infectious stage unknowingly might have had contact with many more people. So visitors are actually low risk to introduce virus into a facility. They're screened, they're putting on a mask. So, and again, most of them are going to be vaccinated, but the vaccine passport is for non-essential opportunities, and it's really to create an incentive to get higher vaccination rates.
Great, thank you, Patty.